So I do realize I have 5 to 6 minutes. So I'm going to go as quickly as possible. I will say that I did add some QR codes within my slides. So hyperlinks are very difficult to follow at times in presentations. So I do have QR codes that'll directly link to some of the information I'll be presenting. So for some of you who may not be aware, the National Personal Protective Technology does reside within the National Institute for Occupational Safety and Health, which is a part of the U.S. Centers for Disease Control and Prevention. And really, NIOSH is targeted with preventing work-related injury and illnesses by advancing the state of knowledge and practice of personal protective technologies. So specifically with NPPTL, as the nation's PPE laboratory, we do provide national leadership coordinating what we consider to be equitable PPE protection. So, the title of my presentation is Respirator Fit for All, but really our research program focuses on equitable PPE for all as well. So as part of that framework, we're documenting existing characteristics and gaps related to PPE. We're organizing collaborators across the PPE community. We're working to identify solutions and approaches that actually address these identified gaps and challenges. And then we're also establishing a prioritization framework. And so that QR code up at the top right corner actually takes you to our equitable PPE protections workshop, which happens last November. So we do have the recordings available on the website if anyone's interested in learning more about equitable PPE protections or specifically what we consider to be our role. So specifically for Respirator Fit for All research, we're really looking to address the needs of respirator users, as well as address some known gaps related to respirator fit. So this image showed someone wearing a respirator that's incorrectly donned. Clearly there is a nose clip at the bottom and that's on their chin. There's a strap that's under their ear. So this would be an incorrectly donned device. And that's what we're hoping to reduce. So when it comes to respirator users, they do have a series of questions. And, this could be, how do I pick the right respirator for the hazard? How do I pick from all these options of respirators that's on the market to identify one that I think will fit me well? Once I do identify one, how will I know that it fits? How do I know I'm even wearing it correctly or putting it on correctly? How will I know that throughout the day or my work shift or whatever my activity is, that it's going to continue to fit me? And then will other things impact the fit of my respirator, whether that's, eyeglasses or safety glasses or a face shield? NPPTL also commissioned a paper to identify gaps areas related to respirator fit. And that did identify 9 gaps. And this includes, some filter and face respirators do not fit many workers, or, what happens when you wear it for an extended period of time. There's limited knowledge there. Our regulations in the US associated with respirator approval, they may not accommodate new and innovative approaches to well-fitting FFRs. There's also very few studies related to respirator design for members of the public. And we know that to be true because a lot of the anthropometric data, isn't based on the public population. A lot of it's based on military population or working population. And then the comfort is important, but we really don't understand it. Tons of publications were published during the COVID-19 pandemic and everyone, it seemed like, came up with their own way to identify comfort or their own scale. So even when you compare paper to paper, it's very difficult to identify or difficult to make comparisons because they are using very different metrics. And then the impact of facial hair on fit, or providing solutions for people that do have facial hair or full beards is poorly understood. Again, the interoperability of FFRs with other PPE, whether that's goggles or face shields and things like that. And then we need a better understanding of respirator performance in real world settings, as well as ASTM F3537 may not be adequate for new fit test methods and instruments. So I'm going to go through some of the things that we're actively working on within NPPTL to address these gaps, as well as address these respirator user needs. So the first thing we're doing is we're integrating ASTM F3407, which is the respirator fit capability standard, into our approval process for respirators. And so that standard defines the performance requirements for ensuring that the model can achieve a pass-fail criterion, which is over 50% based on the NIOSH bivariate test panel. So that requires 25 people who meet the bivariate test panel requirements, and then the respirator would have to pass 13 of those 25 fit tests. And then the hope is that it really assures the respirators can be expected to effectively protect the wearer against particulate contaminants. This is a clean air workshop. We are talking a lot about clean air, but realistically, there's a lot of situations, where the air just isn't clean. So we do have to rely on respirators and respiratory protection. And we do want to be sure that when we do wear these respirators, it's giving us the protection that we expect and the protection that we need. Now, this doesn't eliminate the need for a fit test, but really the purpose of us including it within our respirator approval program is to increase the probability that the available respirators will fit the general working population. Another thing we've done is we've partnered with NASA to develop the Respirator Fit Evaluation Challenge. So this is an open competition. It is a crowdsourcing challenge. It pulls on innovators and the public and small businesses to come up with a solution for fit testing. So the focus is on filtering face piece respirators. It is a multi-phase, multi-year effort. We're currently in phase 2. So phase 1 has ended. It does have a total prize purse of $350K. But really the goal is to have, these innovators create a solution that'll be market friendly, user ready to provide solutions for fit testing. This could be a new fit test method. This could be a real-time fit monitoring tool. It really is something that we hope to make widely available to support fit testing and respirator fit evaluation by all, whether that's the public or occupational settings. And this QR code in the bottom right does take you directly to the Respirator Fit Evaluation Challenge website. So these are our phase 1 solution winners. All of these winners did go on to phase 2. I think one of them did remove themselves from the phase 2 challenge. As part of phase 2, they are required to develop prototypes, and then they will be tested by NIOSH. Another thing we're developing is a mobile facial scanning app. So, one of the questions that I mentioned that respirator users may have is, how do I pick a respirator that may fit me well? So one of the things that we're working on is developing a mobile facial scanning app. It will be available on smart devices, whether that's Apple iOS devices or Android devices. It'll take a scan, whether that's a picture or video of your face. And then initially, it's going to put your face into our NIOSH bivariate panel, as well as our NIOSH PCA panel. The benefit of putting you or categorizing you into that NIOSH PCA panel is that PCA panel directly informs these 5 ISO digital head forms. And we have these head forms in our lab. So that means if we can figure out what your head form size is, we can do mannequin fit tests to determine which respirators fit these facial head form size as well. So if we can match you to a head form size, we can then recommend a respirator that we expect to seal your face well. But it also allows us to determine when people don't fit within the bivariate panel well, or someone doesn't fit well within our PCA panel. So it will have the option within the app to send your facial scan back to NIOSH along with some demographic information, because we may identify we need another head form size, or we need a new panel cell to accommodate the needs of the working population, as well as the needs of general public who may be wearing respirators. So this link in the bottom left actually takes you to our ISO digital head form webpage. So let's say you identify a respirator you expect to fit you. You go pick it up from your local hardware store, and now what? You can't do fit testing at home. It may not be possible to get it from your employer if your employer doesn't have a respiratory protection program. So another solution we're working on is the development of an evaluation of a train the trainer program to support equitable and effective respiratory protective device use. So this will be a national framework. It's a fixed firm price contract with the Public Health Institute in partnership with the California Department of Public Health. And the goal is really to utilize our community-based settings and our trusted communicators to provide respirator selection information, respirator use information, as well as actual fit tests. So the goal would be, let's say there was a wildfire, you're located in California. In theory, you'd be able to go into your local fire department and they can give you a fit test for the respirator that you bring. So that's really the goal. So by having this framework and this train the trainer program, we'll train a series of trainers that can then go on and train the next series of trainer on, framework and guidance and implementation information that's provided by us. So we can support, respirator fit testing as well as respirator selection nationwide. Another issue that I mentioned was, or another gap is, how do you support FFR use by those with facial hair? And there's numerous reasons why someone may maintain facial hair. It could be religious reasons, it could be cultural reasons, it also could be medical reasons. So a lot of research has been conducted looking at, under mask beard covers. This is not a NIOSH approved configuration. So, this would not be in compliant with US workplace settings. However, we are going to develop an in-house research study where we look at the respirator fit capability when people who have unshorn beards wear these beard bands and then wear a respirator over the beard band. So what we're working on now is developing a federal register notice, because we do want to solicit current NIOSH approval holders that may be interested in this type of configuration. Because if we do the research and they say, hey, we're really interested, we would like to consider how to make this an approved configuration, with the right data and coming back to a NIOSH for approval, this is potentially a NIOSH approved configuration. But it would be up to that NIOSH approval holder to pursue that. So in summary, our goal for FY24, this is a CDC NIOSH goal, is, how do we identify innovative solutions to assess and validate fit of a wide variety of respiratory protective devices and improve adoption by end users. So I shared quite a few things that we're doing with you all today. And I'm happy to take any questions. And this is my contact information if anyone would like to contact me directly.